Welcome to As a Woman, Fertility Hormones and Beyond. I'm your host, Dr. Natalie Crawford, and I am a board-certified OB-GYN and fertility physician, and also co-founder of Fora Fertility in Austin, Texas. Each week on this podcast, I discuss health and fertility and how they relate to your true self. Become a part of the community of collaboration that amplifies others as a woman. I hope you enjoy the episode. Hello and welcome back to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, and today we are talking all about my top tips if you are trying to conceive. I know that if you are ready to get pregnant or if you are trying, there are so many questions that may go through your head, and I have been in your shoes in the past myself. Anytime you are in this position, it's always hard to get information that you can trust. So today we're going to go over quickly some of my top tips, what I recommend you do, and then also rapid fire answering some of your top trying to conceive questions that you have called in and asked. In this episode, you're going to hear some of the voicemail questions that you, the listeners, have called in and asked. These are my favorite questions. So if you have your own questions, something you're curious about, don't hesitate to pick up the phone and leave a voicemail. The As a Woman voicemail number is 657-229-3672. Again, that is 657-229-3672. Before we jump into trying to conceive, I want to say thank you guys so much for all your love and support on the podcast and on all of the endeavors. Just today, I had a patient graduate and she found me, she found the practice, she found Fora because she consumed content. She saw videos on YouTube and listened to the podcast well before she ever needed to become a patient. Then when she had her own struggles, she came in and saw me and now she graduated. And it's just a great reminder that sharing this content, if it resonates with you, with friends, family, on your own social media accounts, it can really help somebody else who's struggling and know that there's a good source to get educational info that they can trust. And there's a ton of great fertility doctors out there. You don't have to just come see me, but I really just want to say thank you guys for this amazing community that we've built and for all of your support and sharing and liking and really showing the world that we care about fertility content. It means so much to me. On that note, I will say that we have a weekly newsletter where we put really important updates. Just this week, we sent out an update about Resolve, the National Infertility Awareness Association. This is NIAW coming up this week if you're listening in real time. And I have partnered with Run for Research, who is always a sponsor of Pinnacle Women in Medicine, one of the conferences that you guys know I'm a co-founder of and I love and support. But Run for Research is where you can pledge to run or walk, and they will donate to the charity of your choice. And you can go and pick Resolve, and they will donate money to our National Infertility Association. So please, really quickly, sign up for the newsletter at nataliecrawfordmd.com/newsletter. This is a way for you to donate money to Resolve without having to donate any money at all. Run for Research will donate the money for you. And if you didn't sign up for the newsletter, you can go to learnatpinnacle.com/run-for-research, just like it sounds, and you'll be able to input the miles that you'll walk and run and pick your favorite charity, and you'll see Resolve right on that list. So again, a great way to support our fertility community right here, partnering with Run for Research without having to directly donate any money. All right, so my top tips if you're trying to conceive. These are going to go through a few things before you start trying, when you're actually trying, and then some red flags to be aware of and maybe would change your game plan. And then we're going to look into your questions. You're going to hear these from the voicemail again, and I will be answering them in rapid fire. So the first thing I always like to start with is before you get pregnant or before you start trying to conceive, what should you do? Definitely need to start taking a prenatal vitamin. A prenatal vitamin is something that's going to help provide some of the vitamins and nutrients that you need during a pregnancy. Now, prenatal vitamins, there are so many, and when I first started this job, I honestly used to say, any prenatal is so good, just choose one, it'll be awesome. That's a little bit not the truth right now because there's not regulation and not every supplement is created equal. What are you looking for in a prenatal vitamin? Well, the most important thing is going to be folic acid to have at least 400 micrograms. Folic acid is really important in cell division, and it is crucial for development of the neural tube. The neural tube consists of the brain and the spinal cord. This forms so early in pregnancy. When I do 8-week scans on patients who are pregnant, I can see the spinal cord. So this is really important to have enough folic acid in your body before pregnancy so that this rapid division that's occurring really, really early on can help your baby have the neural tube system that it needs. The reason why prenatals are a little complicated right now is twofold. One is that there's a lot of trendy prenatal vitamins that include methylated folate. We can have an entire debate about methylated folate because on principle, Natalie, I'll use myself, who's not trying to get pregnant, methylated folate might have a lot of advantages for me. It is a downstream metabolite of folic acid, and it has shown to have good blood levels of folate. However, when it comes to Natalie, who wants to be pregnant, the thing that we have to look at is that only folic acid in the form of folic acid has been shown to be protective against birth defects, specifically these neural tube defects. Well, you might say, my friend took a prenatal vitamin that had methylated folate and her baby's fine. Of course, there's always going to be people who are going to be fine on either end. And even if we say hypothetically it's probably the same, it's not proven to be the same. And something as important as your baby's brain and spinal cord, that's not something that I would personally play around with. The other thing that's really important to note in the shift of how we currently eat is that a lot of processed foods are supplemented with folic acid. So a lot of grains have folic acid in them. Well, a lot of people don't consume as many grains. I'll use myself again. I've got celiac disease, so I'm not eating a lot of bread. I'm not eating any bread. And so I'm not eating a lot of products that are actually fortified with folic acid. So there was this buffer in our population where in some of our processed foods, we put folic acid to try to help prevent neural tube defects in case somebody wasn't taking folic acid. But now we're seeing less people eating some of these grains and more people taking not folic acid, that it brings to light this potential risk. And as somebody who has taken care, seen patients who've had babies with anencephaly, failure of brain development, it's terrible and you never want to be in that position. If your very favorite prenatal has methylated folate in it, what should you do? I recommend just buying a simple folic acid supplement as well and then taking that in addition. Now, prenatal vitamins have a lot of other great nutrients in them. In the perfect world, every single nutrient would come from your very perfect diet, but the truth is we don't always live in the perfect world. So things to look for in a prenatal would also include other B vitamins, folic acid's B9, so B6, B12, also vitamin A, vitamin D, calcium, choline, omega-3 fatty acids, iron, vitamin C. These are all really important in the development of your baby. And so there's varying amounts of what you might want in there. But in the perfect world, you would have a little bit of at least some of these to supplement what you may not be getting from your diet. And we really want you to have a prenatal vitamin on board 3 months ahead of time if we can. That way you build up and have enough folic acid stores in your body. The other thing before you start trying to conceive to think about is that you can go have a preconception consult with your OB-GYN. So many people don't even know this, and my friends who are OBs, I know this is their absolutely favorite visit. In this visit, they're going to review any medical problems you have, things that might need to get better before you get pregnant, if there's anything concerning or any additional testing you need before you get pregnant, medications you're on, things you need to stop, things that are okay to continue, and then some basic boundaries of how long trying is too long, and hopefully talking about are there any warning signs that you need a fertility test or fertility evaluation sooner. So OBs love this. I loved my preconception visit when I was trying to get pregnant. It's a time of a lot of counseling and getting questions answered and asked. One other thing that goes along with this that I will say is to consider getting genetic carrier screening. Genetic carrier screening is to see if you and your partner are both carriers for the same condition. A good example is something like cystic fibrosis or spinal muscular atrophy. If you and your partner are both carriers, it is going to put you in the position of power to make the choice that's right for you. This might include IVF with genetic testing so that you can not have an embryo that is affected, getting a copy of each gene. It also might include just educating yourself. And the example I use is I once had patients who both carried a gene for congenital deafness. They were both hearing because they each only had one copy. They had the choice. They could have chosen to do IVF and do genetic testing. And instead, they chose to not do genetic testing of their embryos to try to get pregnant in other ways. But they started taking sign language together. And their idea was we're at least going to be prepared if we have a non-hearing child and already be immersed in this world. And that's what happened. They had one hearing child and one non-hearing. But instead of this being a surprise when their baby didn't pass the newborn hearing test, they already knew what the next steps would be. In the same situation, I've had couples choose to do genetic testing so that they would not fall into that position, because that would be really hard, and they had the ability to make embryos and do genetic testing. I'm a big believer that there's no one choice that's right for you, but you can't make a choice on data you don't know. So get the data and put yourself in the position to make the right decision for you. Before you get pregnant, you're going to want to optimize your health, cut out bad habits, put your body in a great place for pregnancy, take a prenatal vitamin, and consider preconception testing, including genetic carrier screening. When it comes to thinking about, all right, fine, that's all before, but now we want to try, what do we need to do, Dr. Crawford? I'm going to say, number one, I want you to be tracking your cycles. Even if you think you're going to try to get pregnant in 3 months or 6 months, having an idea of when you're ovulating is going to shorten the time to pregnancy, and that is proven in studies. What's really important is that we don't solely rely on apps. Apps can be great. They have been shown to be wrong and completely miss the fertile window majority of the time for certain apps, and that can be really, really concerning. And that is because the app is just using a formula to calculate your fertile window and not taking into account very specific cycle-to-cycle changes or intraperson changes. In the same breath, the app may be very, very accurate for you, and if you notice that your app is accurate with when your fertile window is, excellent, but you should understand, are your periods regular and when are your most fertile days? The fertile window is defined as the 5 days before and then the day of ovulation. This is because the egg can only live for 24 hours and the sperm can live inside the female reproductive tract for up to 5 days. So the 5 days before and the day of ovulation is the fertile window. When you have intercourse, the 2 days with the highest percentage chance of getting pregnant is going to be the day before ovulation and the day of ovulation. So if you're in a fight with your partner, you're only going to have sex 2 days the whole month, those are going to be the top 2 days. However, we usually want you to put a little sperm there before in case you're ovulating early so you don't miss that window. When you start tracking your cycles, I want you to notice, number one, are they regular and predictable? Your cycle should come within a day or two every single month, meaning I should be able to show you a calendar and you should look at next month and point to a day that your period will come and be within only a couple days of wrong. If your cycle is varying by more than this, that could be a sign that something is off. I like to view ovulation disorders as a spectrum. You can have perfectly regular cycles, and then you can have a luteal phase defect, where your cycles are actually regular, but the luteal phase, the second half of the cycle after ovulation, is shorter. Then you have longer cycles where you're ovulating a little bit delayed and you have a longer follicular phase. And then you start getting into irregular cycles where you might be skipping months or it's totally at random until amenorrhea, which is absence of a period altogether. And you can progress through all stages of ovulatory dysfunction, but some of these early and more subtle stages can be a sign of different problems, including ovarian aging, thyroid, or other hormone abnormalities. And those are things that you can potentially either advance care earlier or take a medication and have an improvement in. So you are the one who needs to understand your cycle the best. So number one, if it's not regular and predictable, you should go get an evaluation right away, even if you're not trying to get pregnant. You do not need to wait a set amount of time before you go see a doctor. If you're tracking your cycle, there's different ways to try to decide what your fertile day is. Now, the classic simple calendar method is saying, hey, a standard luteal phase should be about 14 days in length. So I'm going to take your total cycle length, subtract 14, and that'll be the day of ovulation. Your fertile window would then be the 5 days before in that day. So for example, if your cycles are 30 days long, you would say, okay, 30 days minus 14 would be day 16 as your estimated day of ovulation. Now, you would be fertile for the 5 days before that. So days 11 to 16 would be your most fertile days. If your cycles are perfect and very regular, that's going to be accurate. Now, an app that is solely tracking based on days, this is what they're using, some version of this. And if your cycles are longer or shorter or have more variability month to month, they may not be adjusting for that. We can improve the effectiveness of tracking when your cycle is by other methods of cycle tracking. So there is temperature tracking, and this is based on the premise that after you ovulate, the follicle that grew the egg reforms into a cyst known as the corpus luteum, which makes progesterone. Progesterone increases your core body temperature. So if we measure your core body temperature, we can see that temperature rise. That can confirm that ovulation did in fact happen. Another way is cervical mucus monitoring, and this is where you're monitoring the cervical secretions that are coming out the vagina, and you're looking right at the labial lips, and you're looking for type 4 cervical mucus, which is defined as that sticky and egg white cervical mucus. This typically happens right with peak estrogen levels, and so that tends to be the day of ovulation. That's obviously a free and very easy way to track. And then another way is with ovulation predictor kits, and OPKs are urinary-based LH testing. LH is the hormone that comes from the brain that tells the body to ovulate. So your LH is going to surge the day before you ovulate. It's important if you're doing LH testing to know when this first rise is, because in the follicular phase, you have low LH levels, and then you'll have a surge inducing ovulation. But after this, you're going to have pulsatile LH because LH stimulates progesterone also in pulses. Once you get a positive, you do not need to keep checking them, and you need to detect the day it turns from negative to positive. So usually recommend starting those at the beginning of your fertile window as defined by that calendar method. As you get further along, if your cycles are very consistent, you may not need to take OBKs every time. You might be able to know this is when my cycle is happening. But if you're using an OPK, recommend intercourse the day of the positive and the next day, because ovulation is the day after a positive OPK. I would recommend intercourse when you're having type 4 cervical mucus. And then BBT tracking, again, there's a lot of nuance to it, but it typically is confirming that ovulation did occur. So if you're using other tracking methods, some apps are now combining calendar tracking along with wearable technology or tracking basal body temperature to confirm that your fertile days were what we thought your fertile days were. And that is improving the sensitivity and the accuracy of detecting your fertile window. When it comes to having sex, should you have less sex? Should you have sex every other day? There was some thought that if a couple's not used to frequent intercourse and then you go tell them have sex every single day, they may wear out and not be able to have intercourse when they're actually ovulating. And due to that, there was a recommendation to have sex every other day and then the day that you're ovulating. That is a great way to make sure that you're exposing the egg to a lot of different sperm at different time periods. And if you ovulate earlier, there'll still be sperm there. But certainly the same sperm is going to be deposited if you have sex every single day. So if you are a couple that has intercourse every single day, please do not have less sex. You do not need to have less intercourse if you're trying to conceive. We're not trying to pull back that recommendation. We are just trying to augment if somebody is curious about how they can be more efficient and more effective with their timing. In the same breath, because sperm does live inside the reproductive tract for up to 5 days, if you have intercourse 2 to 3 times a week, 2 to 3 days apart, you will be putting sperm there, and you don't even need to track your cycle. I call this the 2-3 method if your periods are regular. So if you have regular periods and you know that they are, and you have intercourse 2 to 3 times a week, you're constantly putting sperm there. So tracking your cycle does become less important for conceiving if you are having very regular periods and having very frequent intercourse. Tracking your cycle does alert you to some of those subtle cycle abnormalities, so I still highly recommend it. Things like a luteal phase defect or subtle issues in your follicular phase ultimately helps you understand your body best. And then there's a lot of talk we can do about how you can use that data to help prevent pregnancy when you want to prevent pregnancy instead of using hormonal contraception. A few other points when it comes to trying to conceive. You don't need to have sex in any certain position. You don't need to keep your legs up after intercourse. You don't need to try to trap the sperm inside your body. Sperm are moving out the fallopian tubes so quickly after you have intercourse that they are getting through the uterus. What comes out of you is that ejaculate, the seminal fluid, the stuff that is protecting the sperm. The vagina is very acidic, and so this ejaculate is alkaline to help protect the sperm so they don't die in the vagina. That is going to come out of your body. So don't think that that's the sperm or that you need to hold any position or hold your pee. Please go to the bathroom. Don't get a urinary tract infection. You don't need to make yourself in any contortion or any weird position in an attempt to try to get pregnant faster. It's not going to make a difference. There's also lubrication out on the market that is promoted as being pro-fertility, saying this lube will help you get pregnant. And yes, if you can't have sex because it's uncomfortable, that lube may help you get pregnant because having sex is a prerequisite for conception outside of the fertility clinic office. But if you are able to have intercourse and it's not painful and you don't need lubrication, no lubrication is improving your natural fertility rates. And in fact, any extra barrier that we're adding to the sperm is going to be detrimental. So you can look up what fertility-friendly lubes are. Some of the best ones are going to include a pH balance like Pre-Seed or Conceive Plus, canola oil, mineral oil, or a hydroethyl cellulose base. Things that are worst: KY jelly, astraglide, olive oil, sesame oil, and saliva. Do not lick it and stick it. That is not helpful for trying to get pregnant. How long should you start trying or be trying before you get a fertility evaluation? Honestly, the current recommendation is going to be age related, but you can get a fertility evaluation at any time. A typical evaluation is going to include testing your ovarian reserve, how many eggs do you have, getting a good menstrual history, checking some basic hormone levels if anything seems off, checking your anatomy, vaginal ultrasound plus some type of imaging for the uterus and the fallopian tubes, and a semen analysis. These are covering the top causes of infertility and might put you in a position to make a change if something is detected early. If you are under age 35, the recommendation is not to try longer than a year before you go get help. But it's important to realize that over 70% of people in this age group will be pregnant within 6 months, and only about 10% or more will be pregnant the next 6 months. So in the back half of that first year, you're having much lower monthly pregnancy rates than you did initially. I see a lot of patients who might come in for an evaluation after 6 months of trying. If everything's normal, we might keep trying for a little bit longer. But if something's off, if that sperm is low or we have blocked tubes, we have the opportunity to intervene and make a different game plan at that moment. The other thing to think about is that if you are 35 to 40, the recommendation is only 6 months before you get an evaluation. And if you're 40, I recommend you get a testing right away before you just go through months and months, because time is your most valuable commodity at that stage of the game. And then if anything is wrong, if intercourse is painful, if your periods are debilitatingly painful, if your periods are irregular, if you have a known history of PCOS or endometriosis, if your partner is having difficulty with erection ejaculation, or they have taken testosterone, please just go get an evaluation. Again, can't make a decision on data you don't know, so put yourself in the position of having the data so that you can make the best choice for you. All right, well, that covered some of my top tips if you are trying to conceive right in time for National Infertility Awareness Week. Again, I would love it if you would go to learnatpinnacle.com/run-for-research and choose to walk or run and put your mileage and pick Resolve, the National Infertility Association, as who you want your money donated to. A great way to fundraise for Resolve without having to donate money yourself. I know the fertility treatments can be really pricey, so some of us don't have money to support Resolve, even if we're really, really passionate about it. So please consider at least spreading the word, sharing your own infertility story if you feel comfortable during NIAW, sharing fertility content like the As a Woman podcast on my YouTube channel, and supporting Resolve and Run for Research. We're going to dive into a few of your top fertility questions when it comes to trying to conceive. I'm going to try to answer these as fast as possible, which is always easier said than done. But if you have your own question, you can call 657-229-3672. Again, 657-229-3672.
Hi, Natalie. I just want to say I love your podcast, and I'm super grateful for all the information you've provided me. I'm calling because I have a question about sleep and time that it takes to conceive. I'm 29 years old, and my husband and I have been trying to get pregnant for 8 months. I got my basic blood work like FSH, LH, AMH, estrogen, thyroid, and it all looks good and normal. Same with my husband's semen analysis. However, I really did not have good sleep habits up until like the last 3 months. Prior to that, I was getting like 5 hours of sleep a night on average, except for the weekends, and then I would just way oversleep. I now have much better sleep habits and average between like 7 and 8 hours a night. So I'm wondering, as far as fertility is concerned, how many months can I really count as trying? Because I keep thinking that I've really only been good trying for the last 3 months that I've had good sleep. But I don't really know. Maybe I should talk to a fertility doctor sooner. So, yeah, I just wanted to get some insight from you on just how important sleep is and if I can even count those months as trying when I was getting really bad sleep. Anyway, thanks for taking my question, and I look forward to hopefully hearing back.
Okay, great question. Any month that you're trying and you're not using protection is considered a month of trying. Yes, I like to think sleep is an important component and it adds to the puzzle of all the pieces we need in order to get pregnant. But we can't just discredit and say these months don't count because there may be a bigger problem underlying it all, maybe part of why our sleep has been such an issue. The perfect sleep habits are going to be getting at least 7 to 8 hours of sleep every single night and sticking to the same circadian rhythm schedule. So, this long sleep on the weekend and shorter during the week is stressful for your body. Your body really wants to, it's like a toddler. It wants to know what to predict. It wants to know you're going to get to bed and get up on time. That gives your brain a lot of comfort to know that it's going to get the sleep that it needs and helps your hormones be the best that they can, functioning the best, have the most regular cycle, and decrease inflammation in your body. I always say that when you sleep is one of the key times when your body is going to heal and recover. And if you are not routinely giving your body that rest, that is impactful. In the same light, 8 months, normal testing, always good to get a fertility doctor to weigh in on their recommendations as far as what would the next steps look like for you and are there different things that you could be doing based on your own personal situation.
Hi, I am 30 and I'm considering trying for my first baby in a few months. I have gotten some hormone labs drawn and it's been a series of a couple months, and something that's concerned me is my testosterone has been repeatedly low. I think initially, it's always lower than 10. Initially when I checked it, probably in April, I think it was less than 3, and then my vitamin D was low, so I started supplementing vitamin D and zinc because I know that these can be precursors to testosterone. And even with a bump in my vitamin D, my testosterone only went up a few points to about 6. And so it's still not within normal range. And I do feel like I have some symptoms of mild fatigue and maybe like a little bit lower sex drive than normal. But in regards to fertility, I wondered if this has any impact. And I just wanted to understand like your thoughts or your advice on improving testosterone and how it can play a role in fertility. Thanks. Bye.
Testosterone is really popular right now and largely in the postmenopausal community. When you're premenopausal, it is important to recognize that high testosterone causes many more problems than low. Testosterone is converted over to estrogen, and so your levels are generally low throughout the menstrual cycle. And essentially, they do vary like estrogen does, but it's typically going to be much lower if everything is working correctly. If you are postmenopausal, however, and now your ovaries can't make estrogen, the testosterone is going to be a much more important component in your body. So if you're premenopausal and you have low testosterone on blood work, I'm not really worried about it if you're still having regular periods. Much more concerned if you're not having periods at all, or if you've got very high testosterone levels, because that can interfere with feedback to the brain and the ovulatory system. Also, whatever you do, please do not take testosterone supplementation. I have had women put on this. It can cause terrible birth defects. It is absolutely not recommended if you're trying to conceive and you are still having periods.
Hi, Dr. Crawford. My name is Michaela, and I really enjoy your podcast. I was diagnosed with endometriosis at the age of 13, so I knew getting pregnant would be a challenge. I was recently diagnosed with PCOS as well. About a year ago when I went to the doctor, when my husband and I decided we wanted to start trying for a baby. After we tried naturally for about 6 months without success, my doctor put me on medroxyprogesterone and letrozole to help induce a period since I was only getting about 2 a year, and then also to help me ovulate. I've tried these 2 medications twice and have not been able to ovulate. My doctor said she recommends I see a fertility provider, but the next available is about 10 months from now. So she also hasn't given me much hope that there's much I can do in the time between now and seeing a fertility specialist. But I was hoping you could recommend any tests or labs or even surgeries I can do prior to seeing a fertility specialist so that I have the best chance of getting pregnant as soon as possible when I do see that specialist. It's also important to note I am 30 years old and I've had 1 prior laparoscopic surgery for endometriosis at the age of 21, in which they found I had a somewhat mild form of endo. I'm also extremely healthy. I take all of the recommended supplements. I work out daily and I eat a well-balanced diet. So I feel like body-wise, I'm healthy and primed for a baby. It just seems like my reproductive system doesn't want to cooperate. So if you have any advice for me, I would love to hear from it. And again, thank you so much for all you do for women. Thank you so much.
Okay, great question. Trying to do rapid fire, so I'm gonna try to be quick. Number one, 10 months is too long to wait. Try to see if you can get an appointment with a different fertility doctor. You can see who sees patients virtually. A lot of us do. It doesn't have to be the person your OB recommended or the person that's closest. That is too long. Also, call the clinic and get on a wait list. Ask for an earlier appointment, or say you have a really flexible schedule and if somebody cancels last minute, could you maybe get added earlier? Try to see if you can get on that list. Make friends with whoever does scheduling because that can help you out. That's a top tip. Second is that what can you do? You can absolutely expedite the process by getting some of the testing done before. So what to ask for? Number one, a semen analysis for your partner. Number two, an HSG, a hysterosalpingogram, which is an X-ray dye test to see the inside of your uterus and your fallopian tubes. This is going to help us know if your fallopian tubes are still open or if they could be blocked because of the endometriosis. Number three, because of the PCOS, I'd want to make sure that you had a thyroid level checked, a vitamin D level checked, a hemoglobin A1C checked, and an AMH or an anti-Mullerian checked. These are all different hormones that can vary with PCOS and can be really advantageous for us knowing what else is going on. If you've got classic PCOS, so you have irregular cycles, signs of high androgens like acne or extra hair or even balding like male pattern baldness, or you have high testosterone levels or androgen levels on your blood work, or an ultrasound that showed PCO ovaries, then maybe you have the diagnosis. If you have anything that doesn't potentially sound like that, two other tests we recommend if patients are having really, really irregular periods, or especially if you're having amenorrhea, meaning no period for 6 months, would be to check a test called 17-hydroxyprogesterone and a testosterone level, and a DHEAS, an androgen level made from the adrenal glands. These are going to help us make sure that there's nothing else going on and that what looks like and smells like PCOS is actually PCOS. And then I really focus on what you can do lifestyle-wise to try to decrease inflammation. Anti-inflammatory diet, cut down the processed foods, cut back on the sugar, cut down on eating out, try to cook meals at home, working out daily, getting good sleep, managing your stress. Those things are all very, very important in inflammatory disorders like PCOS and endo. But coming into your fertility doctor appointment with some of your basic testing is going to be setting you up for success. All right, friends. Well, hopefully you enjoyed some of this episode, top tips for trying to conceive and some of your questions. If you have your own fertility questions, don't hesitate to call 657-229-3672. Again, that is 657-229-3672. You can also sign up for the newsletter at nataliecrawfordmd.com/newsletter, where we have weekly recipes, fertility tips, and exciting updates. Also, you can listen to the YouTube channel over at Natalie Crawford MD. And please don't forget, pick Resolve for your run for research for fundraising for National Infertility Awareness Week. Learn at pinnacle.com/run-for-research. Thank you, friends. Thank you all for listening to As a Woman. It would mean so much if you could rate, review, and follow the podcast to be notified of new episodes every Sunday. I hope you learned something new, and I hope you share it with someone in your life. Be sure to follow along on Instagram at Natalie Crawford MD, and check out the YouTube channel Natalie Crawford MD. If you're interested in becoming a patient, you can also follow Fora Fertility. I'm so thrilled to have you here, part of the community that amplifies others as a woman.